There's a major public policy controversy surrounding the distribution of health products in developing countries. And there's been a debate about whether it's appropriate for non-government organizations or NGOs to charge money for those products when distributing them to the poorest people in the world. On the one side, there are those who argue that charging money is unfair and that it will result in products only reaching the richest of the poor, essentially undermining the purpose of the program in the first place. And on the other side are the NGOs who engage in the practice of retailing health products like insecticide-treated mosquito nets in developing countries, who argue that if these products aren't priced, then people will get them for free and they won't value them, or consequently they won't use them. So we sort of wanted to come into this question and bring some data to it, try to use some economic tools to shed some light on that controversy. Our goal was to test the NGO's hypothesis that charging something or charging more for a product can result in greater use. And we wanted to sort of separate that into two components. On the one hand, it might be that the more you charge, the more the kinds of people you attract will be the kinds of people who are serious about the product. And another hypothesis is that actually charging more for a product or charging something for a product may by itself influence the decision to use through a psychological phenomenon called the sunk cost effect. The sunk cost effect is the idea that even sunk investments can influence my behavior today. Traditional kind of neoclassical economics would say that if I've already paid for something, the amount I paid is irrelevant. My decision to use should only be based on how much it costs me to use more or use less. But Dick Thaler and others in behavioral economics have argued that, in fact, people are sensitive to those sunk investments, and that if I paid for something or paid a lot for something, that might influence my decision of how much to use today. Well, I think it speaks to a broader controversy in the development community over the appropriate approach to development aid. And on the one hand, are organizations that are sometimes called social marketing firms that use what you might call private sector tools or market-type tools to distribute products. So they retail, they brand, they advertise. In fact, oftentimes they have employees who are formerly Madison Avenue advertising types or marketing types. And on the other side are what you might call public health NGOs, take a more traditional approach, distribute products for free through health clinics, have nurses or other local staff tell people how to use their products. So they take a more traditional kind of free distribution plus information approach, and on the other hand is a more commercial-oriented marketing, advertising, branding, logo, retailing approach. And I think our data is getting at one small part of why those two might be different. So we did an experiment in Lusaka, Zambia, in which we went door to door to over 1,000 Zambian households, and we offered to sell a product called chlorin, which is essentially a sodium hypochlorite bleach solution that households can put in their drinking water to kill pathogens and other things that cause waterborne illnesses like diarrhea, which can be especially dangerous to children. And we randomly assigned an offer price so that every household was offered the product at a different price. And then if they agreed to purchase, we would then randomly assign a discount. The idea of this design was that holding constant how much people actually pay, we can vary how much they agreed to pay through this offer price, and study whether those who agree to pay more or willing to pay more seem to use more later on. Flipping that around, holding constant what they agree to pay, we can vary what they actually pay and see whether they transact at a price or the amount that they transact for has an influence later on down the line in how much they use the product. And we returned about 2 weeks later and actually tested their water chemically for the presence of this product using the kinds of chemical test strips you might use to test your pool for chlorination. What we found is that the people who agree to pay more for the product are very consistently those who use more, and those effects are quite large economically. We find no evidence that conditional on paying a price, the amount they pay actually influences their use. So we don't find any evidence for the sunk cost effect in that sense, although some of our data are consistent with the idea that paying something results in more use than paying nothing. Well, I think these kinds of issues come up in all sorts of contexts. I've emphasized the development context, but they also come up in setting school fees or in the private sector. There are lots of industries where I care not only about whether you buy my product, but whether and how much you use it. So for example, if I'm selling a newspaper, I care not only about how many copies I move, but also how much attention people are paying to the copy, because my advertisers care whether people are reading the product or just using it to line their birdcage. And those kinds of issues are front and center in emerging media fields like free newspapers, which have become a much bigger part of the newspaper sector. And I think there you have exactly the same kinds of questions about who am I going to reach if I don't charge for this product, or if I charge too little, and will they really take the product seriously and pay attention to it? And advertisers, I think, are very concerned about issues like that. I've been a postdoctoral Becker Fellow for 2 years in the Becker Center on Chicago Price Theory, which seeks to promote the use of simple economic tools and applications to real-world problems. And I hope that this study can be a part of that greater endeavor, in the sense that we're really trying to study some of the most basic functions that prices serve in markets, and just apply those to an area where sometimes markets aren't thought of as being a part of the policymaker's toolkit.